Hello, I'm Dr. Sampada Dessai, Consultant Gynecologist at PD Hinduja Hospital, Mahim. Cervical cancer is the cancer of the lower part of the uterus or mouth of the uterus. Cervical cancer is caused by a virus called as human papilloma virus. This human papilloma virus or HPV virus is sexually transmitted. These risk factors includes having multiple sexual partner, initiation of sexual activity at early age, having multiple children, having children too frequently, use of oral contraceptive pills more than 5 years, or any immunocompromised state. At early stage, this cancer is asymptomatic, that it does not have any symptoms. Most of the time, early stage cervical cancer is detected on screening test. Some of the subtle symptoms of early stage cervical cancer includes postcoital bleeding, that is bleeding after having sex, intermenstrual bleeding, that is bleeding in between the menses, vaginal discharge, or postmenopausal bleeding. For early stage, cervical cancer can be treated by either surgery or chemoradiotherapy. For advanced stages, this cancer is treated by chemoradiotherapy. Cervical cancer can be prevented by two methods, that is by screening and vaccination. Screening is done to detect the cancer in early stages or in precancerous stage. There are tests that are available to screen this cancer. The main tests are Pap smear test and a HPV DNA test. Pap smear test is recommended for all women who are sexually active after the age of 21 years. This test looks for abnormal cells at the cervix. HPV DNA test is recommended for women above the age of 30 years. Pap smear test is to be done every 3 yearly, and if this test is done along with the HPV DNA test, then the test frequency can be increased to 5 years. The testing has to be continued up to the age of 65 years. Other method of prevention of cervical cancer is by vaccination. This vaccination is against the HPV virus. Now there are vaccines available in the market which are recommended between the age group of 9 to 26 years, which can prevent the HPV infections from occurring. Screening and vaccination can prevent cervical cancer from occurring. Being aware of the symptoms of early stage cervical cancer and reporting them early can help in early diagnosis. Early diagnosis of cervical cancers can help us to cure the cancer completely.